Welcome everyone. Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. For those of you who are awaiting test results for COVID-19, you can now obtain your results online. Please check the Ministry of Health's online portal. You will also find the link on our website. Please note that at this time, our health unit staff will continue to follow up with you directly to provide your results. With the number of tests pending, results may take up to 4 days. Once you have received your results, you will also be given instructions as to next steps. Please remember that while you are awaiting your results, you must remain in self-isolation. Overall, 4,324 individuals have been tested for COVID-19, and of those tested, 557 tests are pending. I will now share the most current case counts. There are 36,831 confirmed cases of COVID-19 in Canada and 11,184 cases in Ontario. Chatham-Kent has 31 cases, and Sarnia-Langton has reported 148 cases. Michigan now has 32,000 cases, with 7,736 cases being in Detroit. Today, we are reporting 506 cases of COVID-19 in our community, an increase of 24 cases from yesterday. 41% of all cases are in long-term care and retirement homes. 88 cases have been resolved. 18% are between the ages of 50 and 59 years, and 23% of our cases are 80 years and older. 39% are male, 60% are female, and 1% are unknown at this time. Our community has lost a total of 31 people to COVID. 22 deaths have occurred among residents in long-term care and retirement homes. Our health unit continues to work with 6 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Symptoms of COVID-19 include fever, cough, difficulty breathing. However, other symptoms may present, such as being extremely tired, falling, having nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, complete the online self-assessment tool, or contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. Windsor-Essex now has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. These include healthcare workers, caregivers, care providers, first responders, residents and staff of long-term care homes and retirement homes, and residents in the community referred by testing by their health unit or the primary care provider. Please continue to visit wechu.org for the most current information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. As we are reporting for 24 additional cases and 4 additional deaths in our community. 2 males in their 90s, 1 male in his 60s, and 1 male in his 40s passed away yesterday. Any life lost to COVID, it's a huge burden on all of us in our community. And we all need to do everything to prevent these losses from happening in the first place. All the individuals that passed away were positive for COVID-19. The 2 gentlemen in their 90s were resident in a long-term care facility. And we are currently monitoring 6 long-term care homes and retirement homes in our community for COVID outbreak. The facilities that are currently under COVID-19 outbreak is Amica, Sun Parlor, Lifetimes on Riverside, Franklin Gardens, Heron Terrace, and Country Village Home. The VCHU has removed Extended Care Southwood Lakes from COVID-19 outbreak this morning. as they met the case definition, to come out of the outbreak case definition. A COVID-19 outbreak in long-term care home is considered resolved when there are no new cases in the staff or residents for 14 days from the last case being placed in isolation. Since its first reported outbreak on April 1st, WeChat has removed 3 facilities from outbreak. For information regarding our outbreak, please visit our website for further details. As announced yesterday, the WeChat is proud to team up with our local primary care partners and hospitals to launch the COVID-19 Population Health Navigator. The Navigator tool, which will be live for today and can be accessed through our website or going directly to ehealthwindsor-essex.ca. I would now turn it over to Dr. Jennifer Bondi. She is a family physician and also the president for Essex County Medical Society, to give us an overview of the tool and walk us through the tool. Thank you for joining, Dr. Bondi.
Thank you very much, Dr. Ahmed, for having me. Thank you very much, Dr. Ahmed, for having me so that we can talk about this today. So as we know, COVID-19 has been around since late last year, and in Windsor-Essex, it's been a primary concern since mid-March, in that it's been impacting the way we lead our day-to-day lives. Obviously, members of the community would have to be able to access medical services to address any questions or concerns they might have regarding COVID. But additionally, we recognize in primary care that people will continue to need to access primary care services, such as their family doctors or their practitioner. With living in this new age right now of having to socially distance ourselves and sometimes self-isolate, the care that's provided is being provided in different means, and that's usually by a virtual means, either by telephone or by video. Now, we know that things have been changing very quickly, and it's difficult to keep up with these changes, I think, probably for most people. And so what we wanted to try and do was to offer a place where people could go to access all available services at this time. And so there is a Denver Hospital pandemic planning team, and within that planning team, there is a primary care action table. This action table has come up with the idea of 3 streams of care for primary care. The first one, of course, is being able to access your primary care provider, your family doctor or your nurse practitioner, and to do so virtually. Secondly, we do know that there are people who either don't have a provider or who are not able to access their provider at this time. And so we wanted to help by setting up a coordinated virtual walk-in clinic. Finally, there is a system in place to help with COVID-related concerns, and those are the 3 streams of care that are available on the website. So for those of you who are following live at home right now, their website is live, PreExistingConditions.ca. So we'll have a look at the website now so I can show you what you can find there. So when you first enter the website, you will see that there is a disclaimer, and this is a disclaimer that we're all using at this time with respect to virtual care. So you understand that there are some potential risks involved. We want to make sure you understand that. So the website will ask you to press agree or decline if you're not in agreement. And then you enter into the site. So on the far left of the site, with the blue background, you can see the local services available. And if you click here, it will bring you to a new site where we have the service provider map. Now this map was previously housed at the Essex County Medical Society website, and it's been transferred over to this new site for everyone. On the left-hand side of the screen, you can see a list of all of the providers who are available currently. That includes family physicians, nurse practitioners, it includes community specialists. There are also diagnostic imaging services such as X-ray and ultrasound. There are labs, there are some pharmacies, and therapists. If you'd like to navigate the map, you can do so either by zooming into the area of the map or using the focus. So for example, if you wanted to look for where you could get an X-ray completed in the community, you would go to the filter function, click on the diagnostic imaging tab, and it will pull up for you the local places to be imaged. Contact information is available in the left-hand column, phone numbers and hours of operation. Now, the next part of the website, if we go back to the home screen, is actually, I'll bring you to the third side. That's the virtual walk-in clinic. If you are not able to access your primary care provider, you can click on this link, and it will bring you to a secure portal where you can press patient, and then you can securely enter your personal health information in order to then be contacted by a local family physician or nurse practitioner. It will ask you a series of questions which you can answer. I should note that if you're not able to access this online, if you have a loved one who could help you out with it, or another person, a neighbor, for example, they are able to speed this step in the process, so long as they can provide your phone number for the doctor or nurse practitioner to call you back with. And that is how that virtual visit would take place. The last component of the website is the one we are most excited about announcing today, and this is the COVID stream. So right here in the center, with the orange background, if you are concerned that you might have COVID, you click on the Learn More, and it will bring you to the COVID-19 checkup.ca website. On this part of the page, it will explain to you some of the background information, who can use the tool, who can complete the tool. It also talks about the hours of operation. At this time, virtual assessments are available from 9 a.m. until 9 p.m., 7 days a week. And people should expect to receive a response within about 3 hours of having completed the tool. The tool, the assessment should not be completed unless you are concerned you have COVID. If you're wanting to do a self-assessment out of interest sake, the Ministry of Health self-assessment tool is available by a link on the page. So when you get to the bottom of this page and you've read the instructions, you can click on the link to go straight to the COVID-19 checkup webpage. And this brings you to the place where you can start your self-assessment. The self-assessment tool looks very similar at this point to the Ministry of Health self-assessment, and that is by design. You will go through the questions of the self-assessment and be given instructions at the end. Some people will be routed on directly to a virtual visit with either their own family doctor or nurse practitioner, or to an on-call family doctor or nurse practitioner. And from that point, if it's determined that the person completing the assessment requires an in-person assessment, they would then be sent on to the assessment center. For those people who have difficulty accessing the assessment center for whatever reason, they would be able to connect by phone with the health unit for further instructions on how best to obtain a swab. I hope that's all clear for everyone. Thank you very much for the opportunity to talk about this new tool.
Thank you, Dr. Bondi, for making this tool available for us. I'm really excited to see that all this is coming together. It will definitely help some of our community members to access the tool and access some of these virtual visits. So I appreciate you and your team taking the lead on it and making it happen for our community.
Thank you very much. line.
We'll now take questions from the media. We'll start with CBC.
Good morning. You said a man in his 40s had died. Is that the youngest person so far from Windsor-Essex?
That is correct.
Is the virtual walk-in a way to what is the best use of the virtual walk-in? Is this a way to not call the nurse's line? Is this a way to not call your local doctor? Is this a way to kind of streamline?
Yeah, so the idea of the virtual walk-in clinic is to provide a service to people who might otherwise have attended a walk-in clinic in person but are not able to do so currently. So we would most definitely encourage people who have a family doctor or a nurse practitioner to try and connect with them first, whether on the phone or by video visit. And if their provider is not available for any reason, then the virtual walk-in clinic would be, they just have to go to the ehealthwindsoressex.ca website, and then they can log into the virtual walk-in clinic to be directly connected with a provider.
And as for long-term care, I know the here in Ontario still says that there's an outbreak. Having the people with COVID in a field hospital, are you still considering an outbreak until all those people's cases are resolved?
Well, the homes will be in outbreak until the last person who was there, either the case or an exposure, they pass that 14 days mark. So their homes will still be in outbreak until we get to the 14 days mark, where there is no new case in the facility, either in the resident or at the staff at the home. Like a field hospital, that's different. So we're talking about just the home. If there is no new case in the resident or the staff for 14 days, we will consider that that outbreak is over in that facility.
Thank you.
We'll now take questions from Blackburn.
Actually, I'm good.
Okay. Any questions from CTV?
I'm just curious what it takes to get rapid access testing. I saw in Detroit they have more drive-through testing with the Abbott ID now. What does it take to have that here?
So we did hear from Health Canada that they have approved a rapid test, but it is not rolled out currently from the government machinery at this time. And also we have reached out to the Public Health Ontario lab to get some details on whether, like, what do we do with this test? If someone is coming back even and saying, I was tested using this, should we accept it as a positive or a negative? We didn't get any information from them. They said that they're actively looking for it, and not just Ontario. Other provinces are also looking at it. They're doing some kind of a validation testing, which is important because we don't want to be in a situation where we are misdiagnosing someone or getting a false negative or a false positive. It would lead to more problems. So as much as I want those rapid test kits to be available, I want to make sure that it is reliable as a mechanism to test someone. As soon as we get the go-ahead from the province and the Public Health Ontario lab, we will be asking that, if you have the access, do it. And we are also asking the government too, would they be making it available for public health units or the hospitals to use that, or would it be in the private sector domain? So we don't know all those details, but we will share those details as soon as it's available.
Any questions from the Windsor Star?
Yes, we're hearing from people with gardening season approaching that they want to buy seeds and plants, and we're just wondering, are any garden centers going to be allowed to open?
That is a question that I think we'll have to check with our with the ministry too. Good question. I don't have an answer, but we can follow up and try and get some answers. As we know, even from the ministry announcement yesterday, that there has been some signs of seeing that the cases are peaking in the province. And there may be some phased approach to loosening the restrictions. So I don't know if that is being considered at this time, but something that we can definitely follow up.
And then at the Southwest Detention Center, the ministry continues to say that nobody has tested positive among inmates or staff. Do you know if inmates or staff have been tested? Are they being tested?
Well, the facility themselves, they are, because it's a facility, they do the testing. They have their own health team. If they are testing anyone, we get the results. If they are testing anyone who's coming back positive, we will get the results, and then we will action on it based on our guidance. As of now, we don't have any confirmed case in the facility, and if it happens, all public health actions will be taken.
Have people been tested there?
Well, people have been tested everywhere. It's not just one facility or one center.
Okay.
Everywhere, each facility, congregate setting, different types. People are being tested everywhere.
Okay, and then otherwise, we're just hearing from family members of inmates who are quite concerned about their loved ones getting sick. Do they have a right to be super concerned about that?
Well, this is a time when we know that COVID-19 is spread in many places, institutions, and they have all these measures in place to early detect cases. They are doing extra physical distancing measures to protect everyone. And this is not an area that we are critically involved in all the time, but we do know that there are measures in place and that are being taken to prevent this from happening in the first place. Early diagnose people if there is any symptomatic person, and then take appropriate action.
Thank you.
Any questions from AM 800?
Yeah, did you say, Dr. Ahmed, that all of the new deaths were all men?
That is correct. 2 male in 90s, yeah.
Okay, so 2 male in the 90s, 1 in his 60s, 1 in his 40s?
Yep.
Okay, so the man in his 40s, obviously the youngest we've had and quite young when it comes to COVID-19. Were there any pre-existing conditions, do you know, that led to the death?
So what we know is the person had a high blood pressure and was an excess smoker. That's all I can say. Other than that, there was nothing else that predisposed him to any other health condition, and that is why it is sad. And I think it's a life lost, which makes us all wonder that COVID-19 doesn't differentiate between gender, age. It can affect anyone. It can kill anyone. And all of us have a role to play in doing our best to prevent and limit the spread of the infection. And also not only for just ourselves, even for our loved ones. If we are not taking appropriate precautions, we are putting them at risk. We are putting our community at risk. So this is a reminder for everyone that no one should be thinking that it's not me, nothing will happen to me. It can happen to anyone and everyone.
Okay, and the person in their 60s as well, still a relatively young age compared to a lot of the deaths we've been seeing. Same question, were there any pre-existing conditions there that led to the death?
Not a lot of pre-existing conditions. I think it's the information that we have. It doesn't point us any details with respect to the health condition or pre-existing condition. We will do our epi summary again this Friday, and if there is anything that we can bring forward, we will bring forward.
Okay, thank you.
Any questions from Windsor?
Just a question about the virtual walk-in clinic. Is that something that's planned to continue after the COVID-19 outbreak, as though it would be sort of a new form of walk-in clinic accessibility?
I don't think that's been discussed to date. We don't have a plan in place to continue it after the fact. That being said, virtual care is certainly something that I think is becoming increasingly popular. I think it's something that community members would like to see more of, and so I don't think the option is off the table.
Yeah, and if I can comment on it, obviously these virtual cares are more important in communities where there's a barrier for actually visiting the clinic and getting access to a healthcare provider. And these virtual visits do not replace the need for an in-person assessment. I think a clinician assessment in person is very important to ensure that the physician has the opportunity to go through a detailed physical assessment, which is important. Sometimes people don't even show any symptoms, but on their physical examination, they could show something different. So it's not to replace that. I think it's just there to complement that, and in making sure that people have all kinds of options available. And as Dr. Bondi said, that I that's a good question. I don't know the future of it, but I anticipate that it will still exist in some shape or form, but we don't know that how useful it is and how it will replace everything else.
Any further questions from CBC?
No, thank you.
Blackburn?
Thanks.
CTV?
I'm just curious if we know the youngest person tested or how young we have tested when it comes to children.
I believe we did tested some pediatric population as well. I don't have the exact age, but I want to say maybe in their under 10 as well that were tested. But this is the one that we have seen the fatality, and which is a concern for all of us.
Any further questions from the Windsor Star?
No, thank you.
AMA 100? Windsor A?
No, thanks.
Thank you.
Okay, thank you, Dr. Bondi, for joining us today, and thank you, everyone.
Thank you.